Welcome to the Joint COVID Task Force briefing. We are going to start with some slides today. Total COVID-19 cases reported to date, 237,162. New cases reported today, 78. Next slide. Of those new cases, 14 are pediatric cases. This graph shows the 4 distinct peaks during the pandemic in Shelby County, with the first virus peak in July 2020, then the winter surge, which peaked in January of 2021, the Delta variant peak in August of 2021, and the Omicron peak, which produced the highest daily new cases of the pandemic of 4,442 on December 28, 2021. As you can see, cases have declined steeply through February and March of this year. Next slide. There have been a total of 48,880 pediatric cases reported in Shelby County over the course of the pandemic, and they have roughly followed the same trajectory as overall cases, also declining steeply through February and March of this year. The 7-day average of cases per day is now 54. That is down significantly from the 191 average we reported 2 weeks ago. The 7-day average test positivity rate has also decreased since last week. It is now 1.3%, which is the lowest positivity value over the course of the pandemic. Next slide. The effective reproductive number, or RT, of the virus is now 0.53 and has remained stable over the past 2 weeks. Total COVID-19 positive hospitalizations data as of March 9th, 95, with 83 in the ICUs and 12 in acute care. This is a significant improvement over hospitalizations just 2 weeks ago, when there were 207 COVID positive persons hospitalized, with 49 in the ICUs and 158 in acute care. Next slide. Currently, there are 575 active cases of COVID-19 in Shelby County, down from 1,063 active cases last week. Active cases among children aged 0 to 17 have dropped to 135 this week, compared to 230 last week. Active cases have declined across all age groups, with the highest number of active cases now among the 35 to 44-year-old age group. Pediatric cases now make up 23.5% of all active cases, a slight increase over last week. Next slide. This map shows active cases by zip code, with the darker areas representing zip codes that have higher case rates. Next slide. This graph compares average case rates of children aged 5 to 18 years old in the 6 metro counties of Tennessee. Shelby County, shown in blue, has continued a downward trend that began in mid-January. The other metro counties have also seen decreases, while Sullivan, Knox, and Madison counties still have the highest rates. Shelby and Davidson counties have the lowest case rates of all metro counties in the state. Next slide. And next slide. This graph shows vaccinations by vaccination date, with first, second, and third doses shown in differing shades of blue. In the past 7 days, 1,601 vaccinations have been given in Shelby County. An average of 229 vaccinations were given each day in Shelby County over the past 7 days, a decrease over the daily average of 378 we reported 2 weeks ago. And over the course of the pandemic, the health department and other public providers have given a total of 410,215 vaccines. If we could go back to the previous slide. The Centers for Disease Control and Prevention has launched a new tool to gauge community COVID-19 risk. It's called COVID-19 Community Levels. Anyone can look up the impact of COVID-19 on any United States county by visiting www.cdc.gov/coronavirus and scrolling down to the County Checker tool. When you select Tennessee and Shelby County, it shows that our county is in the green category that indicates the COVID-19 community level is low. Next slide, and then next slide after that. Here, you see the breakdown of the vaccinated population by age. 59.7% of Shelby County's overall population has received at least one dose of vaccine, and the percent fully vaccinated, having completed the series of 2 doses or more, is 51.9% of the population. The age 65 to 74 population is the most heavily vaccinated, with 90.5% in that age range having received at least 1 dose. 30% of children aged 5 to 17 are now fully vaccinated. 70.9% of the overall population age 18 and older has now received at least 1 dose of vaccine. That is an important milestone set last year by President Biden. 61.9% of the 18 and older population is now fully vaccinated, having completed the series of at least 2 doses. Next slide. Last year, the COVID-19 Joint Task Force set a goal of vaccinating 70% of the entire population of Shelby County, and we are now closing in on that goal. More than 472,822 residents are now fully vaccinated, representing 51.9% of the total population, and 59.7% of the total population has received at least 1 dose of vaccine. We continue to make steady progress each week to reach that 70% goal. This is the end of the slides. The Health Department will continue to monitor COVID-19 data and provide updates as needed. However, because all indicators have shown great improvement over the past several weeks, this will be the last regularly scheduled COVID-19 news briefing. These briefings began on March 4th, 2020, when Shelby County Health Department leadership began making itself available to the media once per week for updates about COVID-19 and the local response. This occurred before the first case was confirmed in Shelby County on March 8th, 2020. Through most of 2020, the Joint Task Force provided these briefings twice each week, more frequently when warranted, and once even on the July 4th holiday. We estimate this is our 153rd COVID-19 news briefing conducted by Shelby County Health Department and the Joint Task Force. This sustained effort to be transparent and responsive to the public and the media, and indeed all of our COVID-19 response work, would not have been possible without the support of many from all levels of government and many partnering agencies. The Shelby County Health Department would like to thank, first of all, Shelby County Mayor Lee Harris for his sustained support throughout the pandemic response effort. Mayor Harris has helped us plot a course through the changing pandemic landscape and has always kept the safety and interests of the people of Shelby County at the forefront. Thank you, Mayor Harris. Special thanks to City of Memphis Chief Operating Officer Doug McGowen, who will be at the microphone next, who heads up the City of Memphis's COVID-19 response and has so often joined me at this podium. And thank you to the many, many others in Memphis Mayor Jim Strickland's administration who have worked tirelessly beside the Health Department on pandemic response. A special thank you to Ursula Madden, City of Memphis Chief Communications Officer, and Keenan McCloy, Director of the Memphis Public Library and Information Center, who generously gave us the use of the WYPL studio and staff for many, many months of the pandemic to conduct these virtual briefings. Thank you to Memphis Fire Director Gina Sweat, Chief Angie Shelton, Chief Kevin Spratlin, Manager of the Healthcare Navigator Team, and all the EMTs, paramedics, and staff of the Memphis Fire Department who have provided invaluable assistance with vaccination efforts and homebound vaccinations over the course of the pandemic. I would also like to thank the mayors of all the Shelby County municipalities, including Mayor Jim Strickland of Memphis, Mayor Keith McDonald of Bartlett, Mayor Stan Joyner of Collierville, Mayor Mike Palazzolo of Germantown, Mayor Terry Jones of Millington, Mayor Mike Wisman of Arlington, and Mayor Mike Cunningham of Lakeland. I thank Shelby County Attorney Marlene Iverson and her team for their work on the 29 health orders and directives issued over the course of the pandemic. I thank the Shelby County Division of Community Services and Director Dorcas Young Griffin for her work to mitigate the impact of the pandemic among the county's most vulnerable populations. Thank you to the Shelby County Sheriff's Office and the Shelby County Fire Department for support and assistance in vaccination outreach efforts throughout the pandemic. A special thanks to Director Brenda Jones of Shelby County Emergency Management and Homeland Security Agency, who made her equipment, offices, and staff members available to assist whenever needed throughout the pandemic. And I thank many, many others across county, city, and municipality administrations, too many to name here, who have worked tirelessly throughout the pandemic to assist in our efforts to protect the population from the virus, mitigate economic damage, and ensure a strong and healthy Shelby County emerges from the pandemic. Thank you to the chief medical officers of the healthcare systems throughout Shelby County and to their patient care staffs who have worked tirelessly throughout the pandemic. We salute you for going above and beyond to care for the people of Shelby County. And special thanks to Christ Community Health Services Chief Operating Officer Jenny Bartlett Prescott, who helped organize community testing efforts from the very earliest days of the pandemic. I would like to say a special thank you to Rodolfo Quilantan, Mexican consul, who traveled to Memphis from the consulate in Little Rock twice to speak directly with the Spanish-speaking populations of our community. We also thank Latino Memphis, La Prensa Latina, and Butron Media for assisting us with outreach efforts in the Latinx community. Your help has been invaluable in reaching this important segment of our population. Thank you to Brenda Cash and Pam Wilson, interpreters from Bridges for the Deaf and Hard of Hearing, who have provided interpretation for us these many, many months in order to help us communicate with members of the deaf and hard of hearing community. I'd also like to thank the Health Department's COVID-19 data team, including Chief of Epidemiology Jennifer Comet and Administrator Cassandra Brown and their hard-working team of epidemiologists and data analysts who crunch the numbers each day in order to provide the informative slides we show at these briefings. This data work has been a crucial part of our pandemic response, and it will continue on a modified basis going forward. I thank Kelly Seeley and all of the COVID-19 vulnerable populations team for their ongoing work to schedule outreach testing and vaccination events. And finally, I thank you, members of the news media, who continue to publicize news and information about the pandemic. Please continue to notify the public of vaccination events and opportunities in the coming weeks and months. Vaccinations and booster shots are our best shot at staying well until COVID-19 is history. Shelby County Health Department will continue to promote vaccination and provide outreach events to reach every segment of our county's population. And I would be remiss if I did not thank the residents and citizens of Shelby County. You have been the bravest throughout this 2 years of the pandemic. You know what to do to protect yourselves, and you've done just that. You've done so much to protect yourselves, your family, and the community, and we cannot say enough thanks for your patience, for your time, for your efforts to make sure that everyone that could came out of this better than when we started. With that, I will hand it over to Chief McGowen.
Thanks, Dr. Taylor. Only 150 briefings. It seems like more somehow, but no, I'm not surprised. That's a lot, and we're pleased to be able to be here to share information. I will not repeat all the thanks. I do reiterate all of the thanks that Dr. Taylor offered, but one thing I wanted to mention here, a real advantage that we had in this community is expert medical advice. Dr. Bruce Randolph, you can't see him on camera, is here. Dr. Manoj Jain, Dr. John McCullers, and Dr. Steve Threlkeld have really been at the forefront of this, and we are blessed to have them here in our community to provide that expert advice. So thank you all for what you've done. The last 2 years have been hard on everybody. This pandemic in many ways has been our generational challenge. 2 years ago, we didn't know how things were going to unfold. We didn't have all the resources or information available to guide us. Our response is going to call for an unprecedented level of cooperation by so many people, many of whom Dr. Taylor mentioned, and all of those people are critical to our success. Everybody played a part in our success. It even required a wholesale change in the way that we individually and collectively lived. A whole new level of trust was required of our neighbors, our friends, and even total strangers that they were going to take the actions to keep us all safe. One of the things that I wanted to really call attention to is the special nature of this joint task force. Dr. Taylor mentioned all of the people, but it took real courage for elected officials from all of those municipalities and the counties to come together to coordinate and cooperate in really what was an unprecedented level of cooperation that many of my peers in other major cities did not enjoy. And that's one of the reasons we've been very successful. Also, a special note that leaders of what were competing healthcare systems came together, competing laboratories, competing clinics, cut down all the barriers, and we came together and acted as one unit in response to this pandemic. And a special note about the business owners. So many business owners took actions they knew were going to hurt their bottom line, but were going to protect their employees and save the lives of their patrons. We really want to thank, the next time you go to a local business, please patronize them and please thank them for what they did to get through the pandemic. Many businesses, as you know, did not make it. And so the ones that did survive, we're very thankful for. Our healthcare teams and public servants, the school systems, even students and families were all thrust into uncharted territory when we started this work and doing things they'd never done before. Incredible patient loads that they had never seen in our hospitals. Distributing food to families and children through our parks and our community centers and our libraries, something we had never had to do. Our school systems, on a moment's notice, created remote learning opportunities so that there was no interruption in the education for our young people. And even in our collective memory, we have never had to do anything like the public testing and the public vaccinations and do it in partnership. And the numbers that Dr. Taylor gave, of that 400,000 that were given in the public sector, more than half of those were given by students, nursing students, medical students, respiratory students. Everybody came together to provide some help. And I'm incredibly proud of our collective response. Really is, I'll say it again, unprecedented collaboration by so many who were called to serve. But as Dr. Taylor said too, the grit of people who live in this area really shone through. Traveled to other cities and never saw anything like the compliance we saw here in Memphis and Shelby County with masking, with people staying at home when they're sick, with people staying away from others and not gathering in large groups. So thank you to everybody who lives here. We would not have any success, all of us here, unless you all actually followed some of the lead that was provided. Dr. Taylor mentioned this is our last regularly scheduled meeting of the briefing, but if something changes, we'll be back. But the good news is everybody knows what to do. We stay home when we're sick. We get a test when we don't feel well. We don't just assume it's allergies. We stay away from others when we have symptoms. We wear a mask if we're feeling not well. And quite frankly, we have miraculous tools that we didn't have just 2 years ago. We have accurate, available, and free testing that pinpoints not just that you have COVID-19, but what variant you have. And we can get that result in under 24 hours, and sometimes just a few hours. We have effective and free vaccines that keep people out of the hospital and from getting very ill. We have antibodies that can be administered intravenously for people who do suffer from a disease, but also keeps them out of the hospital. And now we even have oral therapies that you could take a pill to treat early disease. 2 years ago, we had none of that. It's amazing that we have those available to us today. But I will tell you, in Shelby County and Memphis, Tennessee, in our region, because remember, we had participants from Brownsville and West Memphis and Somerville and Fayette County and all over this region coming together. The best tool that we have is that cooperation and spirit of collaboration across all of those folks to come together to deliver a better result for our citizens. And one thing we haven't talked about, COVID has killed far too many Americans, far too many people around the globe. We have had far too much disease here, but our death rate is just about half of what it has been in other areas. And we're blessed because of the institutions that we have here, healthcare, and because of the great efforts of everybody involved. And I'll also mention, as Dr. Taylor did, we had another team member in this fight, and it was all of you in the press corps. I hope you feel like you were part of the team. You asked really good questions. You shared information very accurately out, and we can't get to everybody. Not everybody watches this broadcast, but you all have been incredibly important and instrumental in getting the word out to people, and I think that's also a reason why we've been very successful. So our data team is going to continue to do work. Our healthcare systems are going to continue to do the work, and if something changes, we will let you know. But until then, as I said, we all know the right things to do, and I hope you'll do them so that we can all get out and enjoy what should be, after this weekend's cold snap, an awesome spring and summer in Memphis and Shelby County. So with that, I'll stop to take any questions that you have.
Reminding all of our reporters in queue to unmic themselves, please. First and only question so far, Mandy Hrock from Fox 13 Memphis. Go ahead, Mandy.
Hey, good afternoon, everyone. As many of us are shifting towards that return to normal, I'm just wondering if you could touch on a little more just about how the pandemic has changed over the past 2 years and really what got us to this point, and if going forward, if we're going to just going to have to learn to live with the virus.
Well, that sounds like a medical question on the last part of the question, but the first part, we talked about, life has kind of changed as we know it. As I said, this is our generational challenge. We have so many new tools. I know myself, it was very difficult to get used to, am I using Zoom or GoToMeeting or one of the many tools, and what if everybody can't get here for the meeting? Well, remote work and these new tools are with us today, and I think everybody just assumes they've always been with us, but it was a real learning process as we went through. So we actually have some new tools that can actually help us be more productive, I think, going forward. We will have to live with and manage this, just like we have every new challenge that comes at us. But I think our resiliency is shown through, and this is one more thing that we have to manage in our lives, and folks have become accustomed to that. So Dr. Taylor, I'll let you talk about how things might go forward medically.
Thanks for that question. So really, on the medical side of the house, it's what our health systems and our public health system knows how to do. And fortunately, our community has practiced for this for 2 years. So we are going into a period where hopefully soon we will hear from the CDC that we are in an endemic period. And what that means is that COVID will still be with us. We will still have cases. They will stay low. And at times we may have a spike in cases, much like a seasonal flu. But the good news is, just like Chief McGowen said, we have oral therapeutics. And more important than that, we have a safe and effective vaccine that 2 years ago we did not have. That has been a game changer. It has saved lives. I know that, you've seen the joint task force members get up here for 2 years, show slides, show data, but all of that information leads to one point, particularly after the vaccines came out. Many lives have been saved because a safe and effective vaccine was developed. And now, because of that, we are transitioning into a period where we can start to come into a new normal, but get back to living as we somewhat knew it before the pandemic.
Mandy, do you have a follow-up?
No, I think that does it for me. Thank you.
All right, those are all of our questions so far. Are there any closing statements?
We've said all of the thank yous. There are many more, and people that we may have left out, charge it to our head and not our hearts. But what we want to do is continue to thank Shelby County for all of your efforts, for everything that you've done, big and small, to make sure that we get to this point. And then just remember, continue to take care of yourself, continue to take care of your family, continue to take care of the community, and don't lose that collective spirit that Chief McGowen talked about. We are so excited that we can have this briefing for you today, this last scheduled briefing. And we pray that when you see us out going about daily lives, that you'll come up and tell us your stories about how you're doing so much better on the other side of this pandemic. Thank you so much.
Okay, stand by. We have one question from Ariana Poindexter at WMC. Go ahead.
Hi, good afternoon. Quick question. As you reflect on the pandemic, which was started 2 years ago to the week, could you just talk about your hope moving forward and just reiterate again how residents and our viewers can stay up to date with you all and just how things are progressing and cases and so forth moving forward?
Great question. So our hope moving forward is just like we shared. I shared, Chief McGowen shared, so many people who have got up to this microphone shared, that the collective spirit that we know has always been here in Shelby County, but was on full display over the last 2 years, will continue. We know that we have many other issues in our community to confront on the public health side, on the public safety side. And just imagine if we brought to bear some of the resources, even half of the resources that we brought to bear for COVID-19. We have big jobs to do still in this community, but we have proven throughout this pandemic that they can be done, and we can do those things together. And so the hope for the future is that that spirit will continue. The numbers look great. We pray that people will continue to protect themselves, mask when they're in public spaces. I can't leave this microphone without saying that. Take advantage of getting vaccinated if you haven't done so already. Make sure that you get your booster if you haven't taken advantage of that. And just continue to do everything you know how to do, everything that we've learned how to do over the last 2 years.
Ariana, do you have a follow-up question?
No, that's it. Thank you so much.
Okay, and that so far is the last one. Does Chief McGowen have any last-minute comments? And I'll send it to Dr. Taylor to take us out.
Thank you so much to everyone. Have a wonderful spring and summer, and we'll see you the next time.